For more on this story, we're now joined by Dr. Mpho Maja, who is the Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development. And she joins us via our telephone line. Mpho, thank you so much for joining us this evening here on SABC News. Perhaps maybe if you have a bit of insight here, perhaps you can just tell us about what has caused the latest outbreak of swine flu in George.
Good evening and good evening to the viewers. Just before I even go into that question, just a slight correction. We are dealing with African swine fever, which is a disease completely different from swine flu. Swine flu is caused by an influenza virus, and the reason that I need to make it very clear that they are different is that flu also affects people, so it's a disease that we call zoonotic, whereas African swine fever is a completely different virus. It only affects pigs, both domestic and wild pigs, and it doesn't affect people, as you've said in the introduction. So that is the cause of the virus. You find it in wild pigs, but it also survives in products like meat and other pig products.
And thank you so much for that correction. And do we know what has caused the latest outbreak of swine fever?
The colleagues are out on the ground investigating this current outbreak, but the majority of our non-commercial farmers feed pigs kitchen waste, or what we call swill, and that contains remnants from either restaurants or kitchen of pork pieces. And as I said earlier, this virus survives very happily in meat, refrigerated, and in pieces that we then throw to the pigs. So these pigs eat that. If it's uncooked, they will get infected. And one of the advices that we give to the pig keepers and farmers is, if you cannot afford commercial feed and you use kitchen restaurant waste, please cook it for at least 30 minutes, and that way the virus gets destroyed.
And what would you say are the common symptoms in which you find to animals affected by the African swine fever?
Generally, animals like babies, when they're sick, they don't eat, they don't drink, they become lethargic. So equally, pigs would be like that. But that would be with normal illnesses. And specifically with swine fever, they become reddish, so you would see patches on the under tummy that they are not very good looking, and the majority of them would die. So the advice is, when your pigs are sick, please don't sell them, so that you gain a few pennies and pass the problem to the next person. Seek medical advice from your local private or state veterinarian, and they will assist you.
And Dr. Mpho, it seems as if, in the Western Cape, in George in particular, it seems as if small-scale farmers are really struggling there when it comes to African swine fever. What would you say are the contributions there? Because it seems as if it's concentrated to that region.
One of the interviewees indicated that the pigs are free roaming. And that is one of the reasons that they contract the disease. They would get, as I said earlier, scraps of feed that somebody would have thrown out with the kitchen waste. So what the farmers need to do is to confine their pigs, make sure that they don't mix with other pigs, because even if your neighbor's pigs are roaming, the least that you could do is to confine yours so that there is no direct interaction. But once the infection is in a community, especially communities where cleaning and disinfection is difficult to achieve, that virus will survive in the environment, and every now and then it will keep rearing its head.
And Dr. Mpho, as you've heard in the insert, a number of those small-scale farmers are appealing to government for interventions. Do we know if there are any vaccinations that can help curb this problem in George?
Unfortunately, with African swine fever, there is no vaccine globally. The scientists are working to try and develop the vaccine, but at the moment there isn't any. So the biggest measure to prevent is purely prevention. Biosecurity, make sure you do not introduce the disease into your head, into your pig establishment. There's unfortunately no vaccine and no treatment.
And what is your advice right now to a number of farmers in George who have lost, their livestock? I mean, one has lost at least 47 of his pigs. What would you say to these farmers who are going through such a tough time right now?
The provinces, individual provinces have support programs for farmers that would be in distress for different reasons. So they should approach the provincial veterinary or Department of Agriculture for support. But those that are not affected, my advice is make sure that you prevent. The saying that goes, prevention is better than cure, holds very true for African swine fever. So prevent introduction into your flock. You'll go a long way, and that you can only do through biosecurity.
Dr. Mpho Maja, thank you so much for your time this evening. That is Dr. Mpho Maja. She is the Director for Animal Health at the Department of Agriculture, Land Reform and Rural Development, just giving us an insight there in terms of that outbreak in which we have seen in George, African swine fever. Of course, saying that there is no vaccination and calling on those farmers to reach out to the provincial department.